You're listening to Puma Podcast.
Hi, I'm Franco Luna, Puma Podcast. You're listening to Teka Teka News. In this episode,
Kahapon nasa 50 plus lang tayo. Ngayon po nag-jump na tayo sa 71 dahil may bago tayong cases na nasa 19. Anong ibig sabihin yan?
we talk about the latest spike in COVID-19 cases and the possible return of mask requirements. It's been 3 years since the World Health Organization declared COVID-19 a pandemic.
Community quarantine is hereby imposed in the entire of Metro Manila. For Manila, ayaw namin gamitin yan kasi takot kasi sabihin lockdown. But it's a lockdown. Walang away dito, walang gira. It's just a matter of protecting and defending you from COVID-19.
Yet after months without mask mandates, Manila City says bringing back the requirement is on the table to quell yet another wave of cases.
Tumataas na naman po ang kaso ng COVID-19. Although, kung tutuusin, hindi naman po ganong kalaki ang pagtaas, pero tumaas pa rin po. Yun ang nakakatakot. Kasi for the past few weeks, bumababa na po ang kaso. Ngayon biglang sunod-sunod na araw na tumataas po mga cases. So mag-iingat po tayo.
That's Manila Mayor Honey Lacuna, who's a medical doctor, speaking at the city's Capital Report on April 15. The 7-day COVID positivity rate in Metro Manila surged from just 4.4% on April 1 to 6.5% in the first week of April. That means almost 1 in every 10 tests is coming out positive. That number matters because the World Health Organization recommends a threshold of only 5% for opening economies. Again, the COVID positivity rate in Metro Manila as of the first week of April is at 6.5%. Worse, the positivity rate has gone up in all major provinces except for Pampanga since the start of April. How much of a cause for concern is this exactly? Let me bring in Peter Caiton to process the data for us. He's a statistician at the UP Diliman School of Statistics and he's been tracking the case numbers.
Around mid-February, early March, doon na yung parang nagsisimula na siyang pataas ng pataas. Parang kada linggo, nadadagdagan ng 100 cases on the average per day yung nangyayari. So, meron na nga talagang parang creeping surge. Kasi hindi siya yung mabilis tulad ng natandaan natin like same period last year or January last year na talagang bigla na lang nagtaasan.
What's the prognosis? How bad can it get?
It's likely for us to see an increase in COVID-19 cases, yes. We are seeing that on the average, parang it's going to be around 300 to 500, with some extremes going to be as low as 200 or 130. And yung upper extreme, it could go to 700 in some days. Pero on the average, it's around like 300 to 400 yung nakikita.
In the past 2 weeks, Metro Manila tacked on 1,065 new cases. And as of April 15, 54 cases of the Omicron subvariant XBB 1.9.1 have been detected in the country. Peter says the numbers point to an upward trend in the coming weeks. But he says the availability of data, or lack thereof, makes it tough to accurately project where these surges are headed in the long term. But the Department of Health is urging calm, pointing to the high vaccination rate and low hospital utilization as effective prophylaxis against a worrisome COVID spread. At least for now. Here's DOH Officer in Charge Rosette Vergere at a press briefing April 12.
What is really important at ang dapat natin laging aalalahanin at titignan ay ang ating mga ospital. Kasi itong mga ospital, dito natin makikita kung tayo po talaga ay nagkakaroon na ng problema dahil sa sakit na ito. Fortunately, ang Omicron ay ang binibigay na sakit sa atin ay more of the mild form of the disease.
As of March, more than 78.4 million Filipinos have already been fully vaccinated. That's almost 70% of the population. But the booster numbers aren't as encouraging. Only 4 million have received their second booster shot so far. Still, the Department of Health says it's not time yet to lift the state of COVID-induced public health emergency. Vergara notes that fewer people are getting tested for COVID, and a lower denominator of total tests naturally yields a higher positivity rate, she explains.
Ang positivity rate po kumpara po nung mga naunang taon ng pandemya, hindi siya masyadong significant ngayon dahil alam natin kakaunti na po ang nagpapatest sa COVID-19. Meaning, yun pong denominator ay nagiging mas maliit. Kaya po pag tinignan natin, mas lumalaki po ang numbers natin na lumalabas dun sa rate ng positivity rate.
We're pausing for a quick break now. When we return, where does the latest COVID-19 wave go from here?
I won't call it a surge. I would rather call it a wave. So as the different variants evolve, then those that have not had COVID or those whose antibodies against SARS-CoV-2 have declined, or those that have had COVID and have not had this variant will get COVID. I tell people that. It's like flu. You can get flu again and again and again.
That's infectious disease expert Benjamin Koh with the UST Hospital. What is driving this new wave?
It may be from unvaccinated people, but they don't have the evidence. I mean, unless, of course, the unvaccinated people are the ones that get hospitalized and they get really sick. Like I said, what the vaccine does is just reduces the severity of illness. But getting COVID infections is a different story. I would probably look at the same number if you're looking at RT-PCR cases. But if you're looking at actual infections, my count would probably be 20 times higher. So if we have 500 cases a day, then we probably have more than that. Kasi wala na nagpapa-RT-PCR.
The DOH is also finalizing the implementing guidelines for administering second boosters for the general population. But a December 2022 survey by the social weather stations says that almost 70% of the unvaccinated population still refuses to get the shot. Benjamin says the regions are also a cause for concern.
The number of cases of Davao City contribute to actually almost 10 to 20% of the total cases you have daily reported by the DOH.
Davao is not the only worry. The provinces of Camarines Sur, Misamis Oriental, and the Rizal have all reached the 20% mark in positivity rate. Peter Caiton from the UP School of Statistics says severe cases aren't the only way the new wave can affect us.
It's going to be less deadly. Still deadly, but less deadly as what we have had before. Pero yung COVID naman kasi hindi lang naman death yung kanyang outcome eh. Meron pa siyang ibang instances na magpapakita na mabigat yung pakiramdam ng katawan pag meron kang COVID. It's a little bit more heavier than a typical flu. And you might expect a lot of absenteeism if we have this unmitigated increase of COVID-19 cases.
DOH data from July 2022 to March of this year says that about 11% of unvaccinated admissions resulted in deaths. This quarter, we're expecting the arrival of bivalent boosters, which target specific variants of COVID-19. But for now, government's only procuring a minimal number of vaccines to cover health workers and vulnerable sectors. That's because millions of primary shots have already gone to waste. Experts say getting your jabs is still the most important thing. The kind of vaccine doesn't matter as much as it sounds. The point at the end of the day is to get protected. The hope now is that everyone who needs a booster can get one. Here's infectious disease expert Ron Jean Solante with the final word.
Yung data ngayon, nagsasabi naman na maski hindi bivalent vaccine, pero pag idagdag mo yan as a second booster, yung monovalent vaccine, maganda pa rin ang protection, no? Especially against severe COVID. So hindi ibig sabihin na monovalent, yung ginagamit natin, walang protection. Pinag-aralan natin yan at hindi naman tayo magre-recommend kung hindi gagana yan.
And that was today's episode of Teka Teka News. Again, I'm Franco Luna. This episode was edited by Pidoy Blanco. If you like this episode, share it with a friend or two. And of course, don't forget to follow Teka Teka News and Puma Podcast on your favorite podcast app or on YouTube. At kung bitin ka pa sa news ngayon, we also recommend another Puma Podcast show, A Better Normal. Search for the episode, To Prepare for Future Pandemics, We Need Equity in Medical Care. Thanks for listening.